Blessed day to everyone. Happy World Patient Safety Day. Today, as we are still in the midst of a pandemic, which for sure all of us have never seen in our entire lifetime, patient safety has definitely taken a different meaning, and we see it in a very different perspective. Now we cannot think of patient safety without even thinking first of our health workers' safety. We cannot and should not talk about patient safety if we cannot even take care of our own health workers' safety. We need to protect you, our dear health workers who protect us, your patients. So before I go on as your patient safety ambassador for the ASEAN region, let me again thank all of you, our dear health workers, for your continuous dedication and commitment in serving our patients. My heartfelt gratitude and salute to all of you. For this year's World Patient Safety Day, WHO has selected the theme on safe maternal and newborn care with the theme Act Now for Safe and Respectful Childbirth. Because it was believed that even during the these modern times, even with the advanced technology and science already available, it was said that 810 women die every day related to pregnancy and childbirth. This is in addition to 6,700 newborn babies who die every day and 2 million babies who are stillborn every year, with 40% occurring during labor. What I would like to highlight today is that these were caused by preventable errors. Preventable meaning these are occurrences which could have been avoided from happening due to various systemic or human errors. What are preventable medical errors? A medical error is an unintentional, preventable adverse event, whether or not it is evident or harmful to the patient, which leads to unsafe care. These medical errors are most often made by our health workers who mean well, but operate in a healthcare system that are lacking the systems and processes that are highly reliable, which are present in industries like aviation, nuclear power, and oil. These are some of the examples of medical errors. For example, your son or your brother who tests positive for COVID-19 and is admitted to the hospital due to the lack of masks. Your son's caregiver or probably nurse isn't able to stop the spread of the infection. Hence, your son or your brother was infected by COVID-19. This could have been preventable. Another example is probably your grandmother who goes into the hospital for a hip replacement, but got infected at the site of her surgery and eventually died 5 days later. This is again a preventable medical error. Another example could be your neighbor who has an asthma attack during an allergy season, rushes to the emergency department for a relief. But then the medication that was given to your neighbor is 10 times stronger than it should be, and eventually he dies. That is again a preventable error. Another example could be your brother who met a motorcycle accident. He hit his head and became unconscious. Now in the hospital, they put a tube in his trachea and it becomes dislodged, and eventually he dies. This is again an example of a preventable error. The problem is that preventable medical harm remains a leading cause of death across the world. In fact, in the US, it is estimated that more than 200,000 people die each year, making medical error the third leading cause of death before COVID. Now with the COVID, it's now the fourth leading cause of death, wherein millions die each year globally. But then who actually knows the real number? because this number are just estimates. Add to this the number of the people who are harmed each year but do not die, and this unknown number becomes even higher. The COVID-19 pandemic has shown a spotlight on the systemic safety issues in healthcare today, and this can no longer be ignored. There is no standard mechanism for tracking deaths due to medical error. So all of us right now and all the current statistics that we see are just estimates. Medical errors are really indicated as a cause of death on the death certificate. And most people, in fact, are even unaware, as shown in this survey by the Patient Safety Movement Foundation, which says that 87.3% of the people surveyed have not actually heard about medical errors or patient safety or patient harm or patient injuries. In fact, we never show and we've never seen in any death certificate a diagnosis that says the death is caused by a medical error. For example, someone had a sepsis because of an infection, but we never say in the death certificate that he died because of a hospital-acquired infection because we did not wash our hands during the surgery, or probably a baby dies because of a drug overdose, but we never say in the death certificate that it was due to a medication error. Or a grandmother, for example, who died, and we see in the death certificate that the cause of death is heart attack or cardiac arrest, but we never say that it was because or due to the patient's fall from the bed, had a fracture, and then had a heart attack due to extreme pain. Or a child who died of a respiratory arrest after a heart surgery, which was indicated in the death certificate, but we do not say that the reason for the respiratory arrest was that while she was recuperating in the ICU from a highly successful surgery, we missed doing her suction, and so she was not able to breathe. Some of them were from my personal experience. These are some of the cases that I have seen personally, myself, and yet nobody really talks about it. There are so many other similar stories like this on the Patient Safety Movement website, and we appreciate the boldness of the patients and the patients' families in order for all of us to learn from them. Definitely not to blame anyone, but in order to take appropriate action and fix the systems, processes, and environment that cause them. You may visit the website of patientsafetymovement.org in order to see most of these testimonies. And every day and almost every week, we see more patients sharing their stories. It was in 1999 that the Institute of Medicine, or IOM, published the landmark report To Err is Human. And I encourage you to get a copy of this, which estimated that there was between 44,000 and 98,000 deaths that occur each year in the US due to preventable medical error. Those estimates of deaths were based upon two studies that focus on errors of commission. In 2004, the IOM also released another report indicating that the errors of omission were just as deadly. In other words, patients who did not receive the care that they should have gotten and were harmed as a result. And we see this happening right now with the COVID-19 pandemic. We call it as an error of omission when people who need care are not able to get the kind of the care that they need, especially because our hospitals are now overwhelmed, and as a result, they get harmed. Several additional studies have emerged since then, and which suggests that between 200,000 and 440,000 people in the US and more than 3 million people across the globe die each year due to preventable medical error. Millions more are harmed each year, often resulting in lifelong chronic health conditions. The economic impact of the medical errors that have been committed is said to be worth billions of US dollars in the United States alone. But definitely, the global economic impact is much more bigger and massive. Global estimates have been calculated by the OECD that 15% of hospital expenditures and activity in OECD countries can be attributed to treating safety failures. This is still, again, most likely conservative. I don't know if you're in your hospital, if you're able to capture all these medical errors and if you're able to monetize them, but this is a study that was done that 15% of the hospital expenditures are spent because of medical errors. Now, for the past two decades, there has been a dedicated global effort to improve patient safety. Everyone in healthcare definitely, of course, truly wants to do the right thing. But despite all of our hard work over the years, still preventable medical error continues to claim millions of lives globally on an annual basis. The Patient Safety Movement Foundation, of which I am a part of, was founded in 2012 by Mr. Joe Kiani to advance healthcare safety and has a bold vision of achieving zero preventable medical harm and death across the globe by 2030 by urging and by urgently unifying people to collectively improve patient safety. In order for this mission to be achieved, countries like the Philippines must address three critical root causes. The three root causes of error. Current patient safety data are only estimates, as I have mentioned, and we do not really know how many people are affected each year because we don't have an accurate method for measurement. There is no requirement that the frequency and severity of all medical errors or the resulting patient outcomes is reported to the public. In fact, our Department of Health and Field Health do not require this. Organizations and clinicians are often fearful to be transparent with patients and families about medical errors that have occurred due to fear of litigation or blame. Death certificates do not include, like I mentioned, preventable medical error as either a secondary or primary cause of death and are solely focused on the diagnosis and the physical cause, such as cardiac arrest or sepsis. A focus on system failures instead of individual blame and transparency of all patient harm and death is key. We have also seen that there is misalignment between the goals of healthcare organizations, clinicians, payers, and patients. Healthcare is a very patriarchal industry, so care is more clinician focused than patient focused. Our current care delivery model was designed to provide care for existing disease, not wellness and prevention of illness. Healthcare organizations and clinicians are generally paid according to the volume of hospitalizations, visits, and procedures completed, rather than by the quality and patient safety or safety patient outcomes. But despite the best intentions of those on the front line, we will never eliminate harm in healthcare until financial incentives for healthcare organizations are aligned with the needs of patients. Regulatory oversight and legislation to improve patient safety has increased in many countries over the past 2 decades, but is still not sufficient to capture the reporting, investigation, and learning required on a national or regional level. A regulatory authority in each country, similar to aviation and transportation safety boards, who investigate errors and government administrations to provide enforcement, is necessary to ensure that organizations truly have safety processes in place and can learn from each other. This type of oversight also helps to support a transparent culture of safety in healthcare. The Patient Safety Movement Foundation is dedicated to addressing each of these root causes to reach our vision of zero preventable harm and death by 2030 through the following work. First, we forge global relationships, partnerships, and collaborations to actively promote change for patient safety. Second, we develop and disseminate patient safety education to governing bodies, healthcare professionals, students, patients, families, and the public. And third, we create public demand for safe and highly reliable healthcare. There are several organizations across the world who are now focused on improving patient safety, but none of us can do this alone. We need to work together. The patient safety movement, we work to align everyone who provides, receives, or supports the delivery of safe healthcare and ask them to commit to zero harm. This includes you, our clinicians, healthcare administrators, patients, families, patient advocates, healthcare technology companies, students, policymakers, and anyone else who has a desire to reach zero harm in healthcare. We create relationships with hospitals like you and other healthcare organizations across the continuum of care. We ask them to make a formal commitment to zero harm and provide free training. We provide coaching and shared learning opportunities in exchange. In return, we only request that they share their high-level patient safety event data with us annually so that we can then demonstrate our collective impact. This model was revised significantly this year, and our goal is to continue to grow the number of individuals who are focused on patient safety through this program. Healthcare technology companies can pledge to improving patient safety by openly sharing the data, their systems, or products to generate without knowingly blocking, interfering, or charging anyone to use the data. Right now, there are 93 companies across 13 countries who have signed Open Data Pledge. We also partner with the diverse group of professional societies, associations, and healthcare-related organizations to help us promote patient safety in various ways. There are 108 organizations in 22 countries who have signed a commitment to action letter, which establishes individual goals outlining how they will participate in achieving zero harm. Educational institutions are also included. They are a critical component of our network, as patient safety training must begin in undergraduate and graduate training programs. Colleges and universities can commit to implementing a patient safety curriculum. We engage patients and families by asking them to share written stories with us if they've experienced or know someone who has experienced medical harm. Over 100 stories have been shared across 9 countries and have become an integral part of the narrative during our movement, driving our movement forward. And we are hoping that we can also invoke the participation of our hospitals in the Philippines. We cannot effectively do this work without the help of our amazing volunteers. We have over 700 active volunteers in our network who serve on various communities and work groups. Members of our volunteer governance and advisory board hail from 9 different countries. In addition, we have 39 dedicated ambassadors, including myself, representing 49 countries who help to connect others with us and spread the message of the patient safety movement across the globe. So I am encouraging all of you to take part of the patient safety movement. We are encouraging all of you to take part of the World Patient Safety program that we are initiating today, September 17. These are the actionable patient safety solutions that we have in our website that you can also freely avail of once you sign up and become a member or a volunteer in the patient safety movement. Highly reliable organizations are those who operate for long periods of time without adverse events or errors. High-risk industries such as nuclear power, oil and gas, and aviation have designed reliable systems that allow them to anticipate errors before they occur. You see them in our airlines. Healthcare has been compared to these industries for many years, as everyone realizes that patient care is just as high risk. But most organizations are reactive rather than proactive in identifying harm. Becoming a highly reliable organization requires a tremendous culture shift that is led by the governing body and executive leadership of the hospital. To date, this has been optional for healthcare organizations. And although some have embraced this goal and are leading the way, most have not yet begun this journey because it is not a requirement again by a regulatory authority. At the patient safety movement, we believe that every healthcare organization should be highly reliable. Our APSS, the solution that I showed you earlier, creating a foundation for safe and reliable care, outlines the actionable steps that the leaders can take to begin this work. Such a foundation requires three critical components. First, a person-centered culture of safety. Second, a holistic, continuous improvement framework. And lastly, an effective model for sustainment. The work is not easy and it takes a good deal of time and effort. So we also provide free virtual coaching and performance improvement training to those organizations that have made a formal commitment to zero. Unfortunately, the general public does not understand that patient safety is in fact a problem. In a 2020 survey by the Patient Safety Movement, 91% of respondents indicated that they had heard very little or nothing about patient safety issues in their community in the last year. Generating awareness among the general public is a critical goal for us. In order to make an impact, we believe we have to have a public ground swelling. So far, having those affected by preventable harm and tragic deaths speak up and share their story through the media and their legislators has not seen or has not significantly moved the needle. We host global events such as the hashtag Unite for Safe Care campaign, which again is being held on September 17 during the World Patient Safety Day and annually. And we design our marketing and social media campaigns to show that we are all at risk for harm because we will all be patients someday. In 2020, we had 114,000 views of our hashtag UFSC events in 74 countries. And I hope that all of you will take part in that this year and every year. So the most important thing that we must do to achieve our vision of zero is to create a sense of urgency to address this critical issue. We are designing a patient safety moonshot to create meaningful change in our global care systems. Such moonshots have been successful before, including the landing on the moon and curing hepatitis C, and are a great way to get everyone hyper-focused on a singular goal. This moonshot is focused on advancing the three critical root causes outlined at the beginning of this document. It's time now that we being policymakers, patients, families, clinicians, healthcare administrators, and the general public together to demand safer healthcare systems. Together, we can achieve zero preventable patient harm and deaths across the globe by 2030. And so my final challenge to all of you here is that, are you ready to commit to zero? And these are some of the things that you can do in order to start off with your commitment to zero. First, make a personal commitment to zero by registering in our website. Second, get your organization, your hospital to join in the movement. Third is to pledge or to follow best practices always. Adopt a continuous improvement mindset. Advocate for legislative and regulatory change. Participate in our events and also in our open forums and work groups. And so with that, let us unite for safe care. Thank you very much.